This clinical case is presented by CIFCO Medical Solutions. Hi, I'm Dr. Lacoursière, Interventional Radiologist, and I'm going to present you a clinical case of a pericardial drainage using the RAD-GUIDE device. The patient is a 66 years old man with previously treated lymphoma. He has a large pleural effusion as well as a pericardial effusion. He was considered symptomatic not only from his pleural effusion but also the pericardial effusion and needed drainage. The cardiology team could not drain the effusion under ultrasound guidance, so he was referred to us for a possible CT-guided drainage. The chest X-ray shows a massive left pleural effusion, and the right heart contour seems to be enlarged. This first CT image shows the large pericardial effusion. I thought the easiest and safest way to get access to the pericardial effusion was to use a right parasternal approach and to go directly into the effusion just adjacent to the right atrium. So after skin disinfection and local anesthesia, a RAD-GUIDE was placed on the patient's skin and the anesthesia needle was left in place to demonstrate the skin entry point on the CT image. As you can see at the beginning of the procedure, I usually use the bone window level and width to be able to see well the RAD-GUIDE and all the different holes in the top plate so I can choose the appropriate hole. In this specific situation, I changed the entry hole on the top plate from the second, starting from the right, to the third, and I moved the top plate on the left side so I could get the exact safe path to reach the pericardial effusion and mainly avoiding the right internal mammary vessels, which is very important here. Deep local anesthesia was then performed. The anesthesia needle was then changed for a 18 gauge Sheba needle, which was then moved forward within the pericardial effusion, and the guide wire was then inserted within the pericardial fluid. The Sheba needle and the top plate were then removed, leaving only the guide wire, over which a 8 French catheter was then inserted, allowing to aspirate hemorrhagic pericardial fluid, which was sent for analysis. In this clinical case, the RAD-GUIDE shows its usefulness in supporting the needles, especially when there is very little tissue support, which is often seen within the chest, and it gives needle stability, especially useful for narrow tracts, and also seen with small targets.